Now the team will insert a laryngeal mask that does have an inflation cuff. This mask also has a gastric port that allows insertion of an OG tube after the laryngeal mask is in place. The team is ready to insert the laryngeal mask. Quickly inspect the mask and ensure that all the material is intact without tears or kinks. Attach a syringe to the inflation port and completely deflate the cuff surrounding the mask. Maintaining tension, disconnect the syringe. Stand at the baby's head and position the head in sniffing position. Hold the device in your right or left hand as shown so that during insertion, the hard part of the curved tubing will slide along the hard palate. Gently open the mouth and press the leading tip of the mask against the hard palate on top of the tongue. While maintaining pressure against the palate, advance the mask along the contour of the mouth and palate until you feel resistance. Inflate the cuff to achieve a seal. The device may move slightly outward when it's inflated. Assess inflation by feeling the pilot balloon. Never inflate the mask with more than the manufacturer's recommended volume of air. Attach a PPV device and CO2 detector and begin PPV. Assess for chest movement and equal breath sounds. If ventilation is successful, the heart rate and oxygen saturation should increase. By the time you've given 8 to 10 breaths, the CO2 detector should turn yellow as it detects exhaled CO2. Secure the laryngeal mask and monitor the newborn's heart rate, oxygen saturation, breathing, and muscle tone. This laryngeal mask has a port for insertion of an OG tube. Measure to determine the correct depth of the OG tube and insert it down the port. Aspirate the air and stomach contents and leave the tube open as a vent. If you decide to remove the laryngeal mask, suction secretions from the mouth and throat, attach a syringe and deflate the cuff. Then remove the device. Monitor heart rate, breathing, and oxygen saturation.